Hello there, and happy National Healthcare Decisions Day. I'm Dr. Kaishauna Guidry, and I'm your host of Morning Dove Medical presents Dr. G at the Heart of Healthcare. So today is National Healthcare Decisions Day. It is the day after tax day. I hope everyone got their taxes done. But this day was created by Nathan Cotcamp. He was actually a guest on the podcast last year. So I recommend you go back and look at that episode and learn from the interdisciplinary panel that we had. So we're here with our third season, and let's see, first season, I started off small. It was just you and me talking about what National Healthcare Decisions Day is, a day when folks are encouraged to do their advance directive. Then the second year, we kind of kicked it up a notch and had a wonderful panel and a collaboration with the Heart of Hospice. And there's a lot of valuable information there. So I'll put a link to both of those in the show notes for today. But let's revisit what National Healthcare Decisions Day is. And it's that hashtag NHDD and the year. So it's an annual initiative celebrated on April 16th to encourage and empower people to begin or continue conversations about their wishes for care through the end of life. I know you don't want to talk about it, but we need to talk about it. So stay tuned. National Healthcare Decisions Day is an initiative to educate people on the importance of advanced care planning. It encourages individuals to express their wishes regarding healthcare and for providers and facilities to respect those wishes, whatever they might be. So you can learn more about the history in the previous podcast. So I don't want to spend too much time there because I really want to get to what we're going to talk about today. But first, I want to mention that I am dedicating this season 3 to someone very special. If you follow me on social media, you may have seen that I posted a missing senior post when the Eaton fires occurred earlier this year in Southern California. There were some fires and it was very tragic. You know, we're very accustomed to wildfires, but this particular time, the winds kind of made them worse than normal and a lot of lives were taken. So I have a friend and her grandmother, Dalyce, Curry was one of the folks that lost their lives in the fire, and she was 95 years old. And to me, it highlights the importance of some of the things we're going to talk about today. And so we'll get to that in a minute, but I just want to dedicate this season to her memory. They call her Momma D. And I'll also put a link in the show notes to an article where you can learn about her because she's actually was a Hollywood actress and was in a lot of things that you would know about, like the movie Moses and the Blues Brothers and things of that nature, but I'll let you look into that. So I'm going to turn the tragedy around and hopefully we can learn how to do some advanced care planning and also just prepare for the late stages of life better. So let's move on to the next thing. As you all know, I'm a mobile concierge physician. My website is right here. I have 2 books, uh, mostly in the hospice department, Dr. G's Hospice Pocket Guide for Hospice Physicians, and also The Real Deal About Hospice. I know you may not want to talk about those, but those are books that will help with the end of life, but I want to help folks before they get there. And so that's why the title today is Navigating the Late Stages of Life with a Healthcare Roadmap. And I'm going to tell you what a healthcare roadmap is soon. So The late stages of life, first, I want to define it's when folks start slowing down. Maybe they need to get some caregiving. Maybe they need to downsize and move into a cute little assisted living or independent living, or maybe they move closer to their adult children if they have them. Whatever it is, it's when independence and autonomy of seniors typically starts to kind of shift. And so that's what I define as the late stages of life. Now, why did I define the late stages of life? As you all know, I'm a hospice physician, and I've seen so many stories of people crashing in the hospice. That's a term that is not fun to say, but it's always after some sort of crisis, a fall, few months, in a rehab, not progressing, some some other type of thing, a new diagnosis, and then things change drastically. So, the information that we are providing on this podcast is to help people prepare because we know that people don't like to talk about it until they have to. But it's National Healthcare Decisions Day, and we are encouraging everyone to have these conversations and be conversations champions. But you can't have the conversation if you don't know what's going on. So, I'm here to educate and empower so that you know what's going on. So, the healthcare roadmap, let's just start talking about it. Um, so, you have to understand the destination of your health or of your parents' health. Um, you have to know the diagnosis that's driving you to your final destination. And you need to exercise your right to live and die in bliss. That's something that I'm saying this season. So, the components of a healthcare roadmap, again, this is something that you can reach out to me later if you want help with it, but I'm here to help you work on your own. It's basically knowing the diagnoses that are attached to your medical record, matching them with the medications you're taking. It's understanding your functional, your nutritional, and your cognitive status. Perhaps you're living independently, your adult children live someplace else, but maybe you've been diagnosed with mild cognitive impairment. Well, there's a small percentage of folks that develop into dementia, and so you want to let everyone know so that you can again exercise your wishes in your advance directive. So, next, I want to talk to adult children. Not everyone has children, and you don't have to, but I want to talk to you about your parents, so or family caregivers. You may not know the things that are going on with their health, and it makes sense. You wouldn't know because they've been living independently, going to the doctor on their own, since you went off to college or whatever you did with your life, went off to the military, your parents, your grandparents have been taking care of themselves. But what I would like a call to action for is to plan some things in advance. I know we have all probably heard of some recent heartbreaking news also about Gene Hackman and his wife. I have an article that I'll also include in the show notes. Apparently, he was suffering from Alzheimer's, and his wife was his caregiver, and she unfortunately became ill, and they both passed away. And, interesting in the article, it talks about the adult children. There's some kind of limbo about the estate and things of that nature. So, again, that's another reason to be very specific because sometimes tragic things happen. Caregivers sometimes pass away before the person they're taking care of, and then what happens? So we really want to be specific and plan ahead before we are in a crisis. So let's move on. So I have a few tips here, and this is what I'm calling to age and die in bliss. And I really want to get some feedback from you all to see what you think about some of these topics, because I'm hoping that, we can shift things and that we can normalize planning ahead, advanced care planning. So let's go down the list. to age and die in bliss. Number one, stop crashing into hospice care. Now, I wrote the book with my co-author, Sharon Harris, The Real Deal About Hospice, to help everyone understand when it's time to seek that level of health care. But we want folks to plan ahead so that you have time to choose the best hospice agency, like we learned from Nurse Gerard, right? We want to have time to do all these things. So the healthcare roadmap is one thing that can give us a big picture of what's ahead, but it can also help us not crash into hospice. Next, get a healthcare roadmap. That's why we're here today. And I'll have a ditto for that on my website. You can go download it. So, what is the healthcare roadmap? It's those components that I just described, the diagnoses, the medications, your functional, nutritional, and cognitive status. But guess what? It's a reverse engineered CTI. What's a CTI? It's a certification of terminal illness. It's something that hospice physicians write when people are admitted to hospice care. It's something that Medicare requires, and it's basically a paragraph summarizing how this person came to the point of having a limited prognosis and had this decline in their health towards death. Well, I want you to know what's going on with your health while you're here before it goes down that way. Let's know what's going on here. Maybe you can do a better job of keeping it steady. So let's move on to the next tip, to age and die in bliss. Make sure your advance directive is specific. In the past year, since the last National Healthcare Decisions Day, I've seen a lot of cases of seniors who have a trust in place, they have an advance directive, but it has verbiage for when you lack capacity. We're going to cover this topic soon on the podcast, but that's something that's a process for your independence to shift to your surrogate decision maker, your power of attorney, your healthcare power of attorney, or your financial power of attorney, or a care manager if you have that in the location where you live. So most of the time they're waiting or trying to avert a crisis because that person has not been declared to not have capacity or to lack capacity, I should say. So be more specific about these things. Maybe you can decide at certain ages when you're going to do things. We'll get to that in a second. So, here are some questions I have for you to consider in your advance directive. Who will speak for you? That's your surrogate decision maker. Just just recently, I saw on LinkedIn, one of the care managers, Tina, she wrote an article about the platinum rule. It's doing what others want. I'm sure I'm butchering it, but it's doing what they want for their health and what their wishes are. That's the platinum rule. We know about the golden rule, do unto others as you would have them do unto you. Well, she said the platinum rule is the surrogates should treat others the way they want to be treated, meaning the person who has the advance directive. So that's great there. Now let's move on to where will you live? I have a friend who's a physician who believes that no one should live alone after the age of 80. What do you think about that age? Well, recently I spoke at an independent living and they had a lot of rambunctious responses to that because they figure everyone is different. And so it's fine. No one should make you do anything, but plan it for yourself instead of someone planning it for you, right? There was a senior there in her mid 80s, and she said that she moved into the independent living because her daughters didn't want her to be so far away and have to be on an airplane if something happened to her. And she has a good relationship with them. Not everyone does, by the way. And she agreed to move closer to her adult children so that she's nearby, but she lives in an independent living and she still is able to live her life the way that she wants to. So think about that. Think about when you would downsize from your house or live closer to a family so that they can look out for you. Or maybe moving into a senior community where you can have your own social life and your own, friends and do whatever you want, and that's your home. So it's let it be your choice. That's the theme here. Moving on to the next tip to age and die in bliss. Who will take care of you? If your functional status declines to a point where you need additional care, will you need private duty caregivers? Do you have funds saved for that? Your nest egg, your 401k, that's what it's typically used for. Or will you have to do a reverse mortgage and take money out so that you can pay for your care? Or do you have long-term care insurance or something like that? What how will you take care of yourself? Or how will people take care of you and how will you fund that? Those are important things to think about because you never know what can happen to your health. Who will control your money? That's a big one, really big. And you want to think carefully about that because that can cause a lot of problems in families. So, really consider who who will really advocate for you. Can you trust all your adult children? Can you trust, you know, whoever? I don't know. But you need to be very specific in your advance directive because when folks are in crisis and people are at the end of life, there are a lot of emotions, things are really charged and people do things that they we probably don't expect them to do. So really think hard about who you choose to advocate for you. Will you be in a situation where, people are suing each other and you're just kind of deteriorating? You never know. So be specific in your advance directive so you can have the care that you want at the end of your life or during the late stages of life. Simplify your home and your belongings. How about your heirlooms? I know of a recent case where someone died suddenly, and, now their adult children are, up in arms about a lot of the heirlooms, something that they thought they should have, but these things weren't written down. These things weren't in the advance directive. So if that's important to you, then you be specific in your advance directive. Couple two things that we need to talk about. Plan when you will retire from driving. How does that sit with you? How about you plan a certain age where you're not going to drive and you're gonna maybe be chauffeured or maybe take some other type of transportation instead of the things that we see where a doctor has to report you to the DMV or there's some type of accident that happens and then the license is gone and we're not driving. How about we plan to retire from driving and be in control of that? I want to challenge you to consider that. Consider that age. Just because you can drive does not mean you should drive. And I often hear folks, brag about their parents. Oh, my dad is, X, Y, and Z age, and he can still drive. Well, just because someone can doesn't mean they should. So I want to propose that we plan when we don't live along anymore and when we retire from driving. Let's think about that in our advance directives so that someone doesn't make that decision for you. And lastly, again, we kind of touched on this, plan where you will live and who you will live with, right? So these are some of the topics that I kind of laid out for aging and dying in bliss. In bliss, right? We want to be happy, we want to have a quality of life, and we want to enjoy these years that you have in the late stages of life. And I think you can do that by having a healthcare roadmap. First of all, understanding your healthcare and know what's taking you to the end of your life, and then having the conversations with your loved ones, your family, or whoever it is that is looking out for you so that they know how to advocate for you. And then practicing these things of planning how you want to live your life. We can't avert every crisis, but a lot of them could probably not happen if we had better communication and better planning. And so that's what I have for you today for National Healthcare Decisions Day. This season, we're going to cover a lot of great topics, and we're going to get down into some specifics like we always do. But I'm so grateful to have this platform to talk to you and submit any questions you may have on the website or on social media. And we look forward to a great season 3. So we'll sign out on this season premiere of Dr. G at the Heart of Healthcare. Peace.